Ever wondered why some infections are hard to treat? Ever heard of MRSA? Well, let's talk about it. MRSA, or Methicillin-resistant Staphylococcus aureus, is a type of bacteria that's become a major concern in healthcare. Not just because it's a mouthful to say, but because it's resistant to many of the antibiotics that we commonly use. You see, MRSA is a strain of Staphylococcus aureus, a bacteria that commonly lives on our skin and in our noses without causing any problems. But when it turns into MRSA, it becomes a superbug, a bacterial bad boy that scoffs at the usual antibiotics like methicillin, penicillin, and amoxicillin. This resistance makes MRSA infections difficult to treat, leading to more severe illnesses and longer hospital stays. So why is this a big deal? Because MRSA can potentially turn a minor skin infection into a life-threatening condition. Now that you know what MRSA is, you might be wondering how it spreads. Does MRSA fly, does it crawl, or does it just magically appear? I hate to break it to you, but the spread of MRSA isn't quite that mystical. It's a bacterium, not a fairy tale creature. MRSA, or Methicillin-resistant Staphylococcus aureus, is usually spread through direct contact. Imagine shaking hands with someone who has an infected wound. That's one way it travels from person to person. But MRSA doesn't stop there. It can also spread by sharing personal items that have touched infected skin. Borrowing a towel from your gym buddy, using a shared yoga mat, or even trying on clothes at a store could potentially expose you to MRSA. Now don't panic. Hygiene is a powerful weapon in the fight against MRSA. Washing your hands regularly, keeping wounds clean and covered, and not sharing personal items can greatly reduce your risk of getting or spreading MRSA. So, MRSA spreads easily, but what does it do to your body? Let's find out. Imagine a tiny invisible enemy invading your body. What happens next? Well, when methicillin-resistant Staphylococcus aureus, or MRSA, enters your body, it can cause a wide array of complications. Starting on the surface, MRSA often causes skin infections that may appear as swollen, painful red bumps resembling pimples or spider bites. These can quickly turn into deep, painful abscesses that require surgical draining. But the trouble doesn't stop there. If MRSA bacteria burrow deeper into your body, they can cause severe infections in surgical wounds, the bloodstream, lungs, or even the urinary tract. The bacteria can lead to life-threatening conditions like pneumonia, sepsis, or endocarditis, an infection of the inner lining of your heart. MRSA's resistance to many antibiotics makes these infections challenging to treat, and unfortunately, can lead to fatalities. Clearly, MRSA is not something to take lightly. But what are the main points to remember about this superbug? Let's rewind and revisit the essentials about MRSA. Methicillin-resistant Staphylococcus aureus, or MRSA, is a type of bacteria that's resistant to many antibiotics. It's a formidable foe in our battle against infectious diseases, making it a superbug in its own right. We've discussed how MRSA spreads, primarily through direct skin-to-skin contact, or by touching objects contaminated with the bacteria. Hospitals and healthcare settings are common hotspots, but it can also spread in community settings or even homes. The effects of MRSA on the body are serious. It can cause a range of problems from mild skin infections to severe conditions like pneumonia, bloodstream infections, or surgical site infections. But it's not all doom and gloom. Good hygiene practices, such as regular hand washing and keeping wounds clean and covered, can help prevent the spread of MRSA. It's crucial to remember that prevention is always better than cure. Remember, knowledge is power. Stay informed and stay healthy.